India today has been putting an unrelenting spotlight on VVIP politicians in election mode who've been flagrantly violating COVID norms. Yesterday, we put the spotlight on Karnataka. Today, we will be scaling up and show you how it's happening elsewhere in the country as well. But first, in Karnataka, where netas are mocking COVID norms with this potential super spreader event. While DK Shivakumar, the Congress state chief in Karnataka, continues with his huge Padayatra, two more BJP leaders were seen in public flouting COVID norms after MLA Renukacharya yesterday. Do these norms only apply for the common Admi and the common Mahila like you and me? That's the question we're asking.
Thousands of Congress workers marching in Karnataka. In the same state, BJP netas also ignoring all COVID norms. In UP, election season trumps COVID season. In every part of the country, there is at least one instance of a neta ignoring all COVID norms and holding mega super spreader events. And mind you, it isn't limited to one political party. On your screens is the footage of the Congress's 10-day Padayatra in Karnataka. That's right, it is a 10-day protest where thousands of workers have gathered and the party isn't willing to shorten it even by a day amid the surging third wave. Shiv Kumar has refused to get tested.
You come with respect.
He has refused to call off his protest.
They are looking at politics. They want politics. See, whoever gets a negative in the international, who comes from the flight, they come with a negative certificate. As soon as they enter Karnataka, they become positive. Come, let me see. See where the Padayatra is going on. Not even a single patient is in the ICU. Not even a single death has taken place.
And while the BJP has gone all guns blazing against Shivakumar, but it's a case of the pot calling the kettle black. Here's why. This is the BJP MLA Renukacharya taking part in a local festival in his constituency of Honali, and hundreds came together for the event. Renukacharya did not seem to care that nobody around him was wearing a mask or that there was no social distancing. After this attack from the Congress, Renukacharya apologized and admitted to being reckless. And then there was this, the birthday bash for former BJP minister and mining baron Janardhan Reddy. A huge crowd gathered to wish the neta as he visited the temple. These incidents are not just limited to Karnataka. It's election season in Uttar Pradesh and the season for mega rallies. While political parties have stopped their mega campaigns and moved digital, here is a leader, Imran Masood, holding a show of strength with his supporters. While the general public do their bit to tide over the third wave, our netas continue to let us down, as their own political agenda takes precedence over lives. Bureau Report, India Today.
And while these COVID violations by netas are happening, as we've just clearly demonstrated all across the country, it is happening nowhere more flagrantly and with more defiance than in Karnataka. Despite all the outrage, Karnataka Congress chief DK Shivakumar has refused to call off his huge Padayatra in the state. Shivakumar was seen leading thousands of Congress workers on this Padayatra for the third straight day, unmindful of all the criticism over violations of COVID norms. Shivakumar this time was accompanied by former Chief Minister Siddaramaiah after the former Chief Minister had skipped yesterday's rally. Two Karnataka Congress leaders have tested COVID positive after the party's Mekedatu Padayatra amidst this pandemic. They were actually right there with the crowds. Both leaders had come in contact with Shivakumar, who has so far been refusing to take a COVID test. Former Minister Revanna, who took part in day one of the inaugural Padayatra with DK Shivakumar, has tested positive. CM Ibrahim, a sitting MLC, is also positive. He took part in the MLA's meet at DK Shivakumar's residence just one day before the launch of the Padayatra. Meanwhile, an FIR has been registered against DK Shivakumar, his brother DK Suresh, and 41 leaders of the Congress for this ongoing, bizarre violation of COVID rules in the state. Want to quickly go across to India Today's Nagarjun Dwarakanath joining me live from Bengaluru. Naga, multiple FIRs have been filed. On India Today, since we're the only channel that doesn't take sides, we have clearly established that COVID violations cut across party lines. There are at least 3 BJP leaders who've had these huge processions and rallies, including MLA Renukacharya. But the spotlight is also on this huge Padayatra by DK Shivakumar. His continuing defiance remains unrelenting. He is in no mood to give up. In fact, his anger against the Bombay government appears to be escalating. Another FIR has been lodged against him. 2 people have even tested positive in his rally.
Well, that's true, Shiv. In fact, the Congress remains defiant, especially the KPCC president. What we are hearing is that after 2 netas tested positive today, a lot of them went up to DK Shivakumar, suggesting him that should we put off the Padayatra till the wave goes down. But he remained defiant, saying, even if no one comes, I will walk alone. And this has become an ego issue at this point of time. It has become Congress versus BJP, and to see who will take the last step here. Who will go on the front foot, who will go on the back foot. Both Congress and BJP don't want to do it, while the people here are the sufferers. At the end of the day, the corona spreads across Ramnagara and the Bangalore rural districts, and who will be held responsible is the question the CM is asking. And the night curfew and the weekend curfew is only for the people. If people step out, even to the 2 roads beside by their house, the police are hitting them with lathis, while the Congress netas are going marching in thousands of number. And not just Congress, BJP too are guilty of violating COVID norms. Today we saw Janardhan Reddy holding his birthday party. Yesterday was Renukacharya. This is happening across the party lines while the people are suffering here. But what remains to be seen is what would have changed in 2 weeks or 3 weeks if the Congress Padayatra was postponed. People did suggest it, but it seems like DK Shivakumar didn't want to listen, and he was quite adamant that it would happen from Jan 9 to 19. And he went on to say that there's no COVID in Karnataka. All the numbers are fudged, and purposely the government is giving higher positivity rate, higher cases to make sure that they will only have curbs on Congress Padayatra, which seems really, really bizarre. But we'll have to wait and watch how many more Congress netas will turn positive. With the crowd that is coming in for the Padayatra, seems like 100% sure more and more Congress netas will be positive, unfortunately.
This is a matter of not just their individual safety, but the safety of other people who are there in the crowd, people who have come in contact with them. This is flagrantly irresponsible behavior by the Congress state leadership as well as by BJP leaders in the state, because the example being sent out is that the action against the Congress is hypocrisy if BJP leaders are allowed to similarly hold processions like Renukacharya and others. So that is the point that we are making. There can be no selectiveness in terms of action against those who are violating. If you're taking action against DK Shivakumar, action must be taken against the others as well. Nagarjun, thank you very much for that. And remember, what's happening in Karnataka by the Congress leadership there flies in the face of how the Congress is handling COVID in other parts of the country. And rightfully so. Take, for instance, the COVID surge in the national capital of Delhi, which is continuing to rise. Delhi has recorded 19,166 cases and 17 deaths, with a positivity rate mounting to 25%. That's a season high. However, the infections were slightly lesser than the previous day. On Sunday, the national capital had recorded 22,000 cases. COVID infections have hit Delhi police as well, with at least 1,000 personnel testing positive so far. The Delhi Disaster Panel has imposed new restrictions in the capital to stem these rising cases. Private offices have been shut. Work from home has been made compulsory. Private offices providing essential services will be allowed to function. A complete ban on dining at restaurants has been imposed. Takeaway and home delivery by restaurants are being allowed. Shops inside malls and at marketplaces are operating at an odd even basis between 10 a.m. and 8 p.m. Whereas only one weekly market is being allowed per zone. With these new restrictions, weekend curfew will continue in Delhi. Meanwhile, Chief Minister Arvind Kejriwal has announced a special yoga class for COVID-positive patients who are under home isolation. He says that yoga will help people of Delhi in the fight against COVID. He's also taken stock of COVID preparations at the dedicated LNJP COVID hospital in the national capital.
जो लोग होम आइसोलेशन में इस टाइम हैं, उनके लिए स्पेशल योगा के और प्राणायाम के कुछ क्लासेस हम लोग शुरू कर रहे हैं, ऑनलाइन क्लासेस। वो अपने घर बैठे हमारे इंस्ट्रक्टर के साथ योग कर पाएंगे। इसके लिए हमने पूरी तैयारी कर ली है। इंस्ट्रक्टर्स की एक बहुत बड़ी टीम तैयार की गई है, जिनको स्पेशल कोरोना से संबंधित कौन कौन से आसन हैं, कोरोना से संबंधित कौन कौन से प्राणायाम हैं, इनकी ट्रेनिंग, स्पेशल ट्रेनिंग दी गई है इन सभी इंस्ट्रक्टर्स को। पिछली वेव के मुकाबले में ये वेव बहुत माइल्ड है। ये ऊपर वाले का शुक्र है कि हम लोग सब एक बहुत माइल्ड वेव से डील कर रहे हैं, नहीं तो दूसरी जो अप्रैल में वेव आई थी वो बहुत ज़्यादा खतरनाक थी। इस वक्त जैसे 136 मरीज़ ओमिक्रॉन कोरोना के यहाँ पे अभी भर्ती हैं। 136 में से केवल 6 पेशेंट्स ऐसे हैं जो कोरोना के इलाज के लिए आए थे। बाकी 136 में से 130 पेशेंट्स ऐसे हैं जिनमें इंसिडेंटली कोरोना निकला। वो किसी और बीमारी के लिए आए थे लेकिन इंसिडेंटली कोरोना निकला।
Hotels still were suffering because unless and until travel really starts, there will be no business in the hotels. In the first COVID wave, the performance went to 1 to 3%. Obviously, everything was shut down. The second COVID wave, it came down to about 11 to 15%. Situation is really grim. We have to realize that this is the only sector which has been hit badly. I mean, of course, all of them have been hit badly. This is the worst.
देखिए, नंबर तो बढ़ते जा रहे हैं। अगर आप पिछले 8-9 दिन से ही देखें तो ऑलमोस्ट 4-5 टाइम्स हो गए हैं। कहाँ 200-300 जैसे दिल्ली में शुरू हुए थे, कहाँ 20,000 क्रॉस कर चुके हैं। जिस तरह से नंबर बढ़ रहे हैं तो ऑलमोस्ट एक पीक आने वाली है जनवरी में। और मैं आशा करता हूँ जैसे जो साउथ अफ्रीका में हुआ था इस पर्टिकुलर स्ट्रेन में, सीधा ऊपर गई थी और सीधा ही नीचे आई थी। तो मैं बहुत उम्मीद करता हूँ कि जिस तरह से अनफॉर्चुनेटली ऊपर गई है, आई होप फॉर्चुनेटली वो नीचे भी आए और सडन फॉल भी हो, स्टीप हो।
So let's quickly, because things are changing so rapidly in this escalating situation with Omicron, let's just remind those of our viewers who live in the national capital what things are open right now and what is shut. Also, essential services obviously will continue. Shops selling essential items can remain open. Only home delivery of food is allowed. So restaurants are not allowed. Malls are being opened on an odd and even basis. Private offices providing essential services are allowed to stay open. 20 people are allowed at marriage functions. Only 20, remember that. Metro and DTC buses are running at 100% capacity because the logic is that if they reduce the numbers, then there will be more crowding. Only one weekly market is being allowed per zone. Now, what is closed? Non-essential private offices are shut, only work from home. Schools and colleges all shut. Dining in at restaurants is not being permitted. Public parks and gardens are being closed. Spas and gyms among the first to be closed, and cinema theaters are also being closed right now. As India makes sense of the Omicron spread, one concern is about booster doses. The other concern, of course, you've guessed it, is about the vaccination of children, especially young children. When are they going to be vaccinated? Concern is growing over COVID cases rising among children as well. There's been a steep spike in hospitalization of children, especially in the United States. And while this trend of COVID cases is different here in India, doctors claim children are vulnerable to infection from the Omicron variant, which is anything but mild in children getting infected. Milan Sharma gets you up to speed and answers some of the questions parents may have.
Omicron has led to a surge in hospitals in the United States. While the new variant of coronavirus is believed to be milder than Delta, more children under 5 years are reaching the hospitals in America. Last week, a record number of children ended up in hospitals across the US, the highest level since the pandemic began. Since mid-December, the hospitalization rate in these youngest kids has surged to more than 4 in 1 lakh children, up from 2.5 per 1 lakh. The rate among children between the age of 5 to 17 is about 1 per 1 lakh, according to the CDC. This data is drawn from over 250 hospitals in 14 states in the US.
So Omicron, again, is less virulent or dangerous than prior strains. And most children that get Omicron have no or mild symptoms. Rarely, children can progress to severe disease. It's rare, but it can happen. About 2% of the COVID hospitalizations in the United States are in children. 99% of the hospital admissions can be prevented if children were just fully vaccinated.
The US experience with Omicron could hold lessons for India. Children here too can be vulnerable. Sources tell India Today that 2 children aged less than 2 years were admitted for COVID treatment in Delhi's Chacha Nehru Bal Chikitsalaya Hospital recently.
Despite the fact that these 2 children tested positive, they were critical and admitted in the hospital. This brings in the argument that whether children can handle COVID better should change at the moment since they are not vaccinated, and also in the light of Omicron that causes different symptoms from the Delta, how much are children protected or how vulnerable they are needs to be reassessed.
Doctors say symptoms among children aged below 18 are not mild this time, though most cases don't lead to severe disease.
Regarding pediatric, severity is almost same as compared to the Delta. In adult, as compared to the Delta, severity has gone down. Probably because of vaccination, that might have contributed. So in pediatric, severity is same.
Data on children's hospitalizations has so far not been provided by the authorities in India. However, if the US data is anything to go by, children too are vulnerable to severe illness from COVID. With Milan Sharma, Bureau Report, India Today.
COVID third wave is here as India witnesses a massive spike in coronavirus cases. Thousands of cases on a daily basis in all our big cities. The caseload is rising at a much faster pace this time. The country has breached the grim mark of 1 lakh cases per day in just the last 10 days. But will we witness a third wave's peak anytime soon? Sneha Mordani brings you this report.
The third wave is sweeping India. The country is seeing an exponential growth in COVID cases. India reached the 1 lakh mark in just 10 days this time. The 1 lakh figure was reached in the second wave in 50 days and 120 days in the first wave. On Monday, India reported close to 2 lakh infections. Mathematical projections indicate that this is going to rise further.
ये बहुत ज्यादा तेज फैलने वाली सुनामी जैसी लहर है। जो आंकड़े हम देख रहे हैं, ये पहले आंकड़े कभी नहीं देखे। टेस्टिंग संख्या और टेस्टिंग लैब्स के ऊपर भी उसका थोड़ा स्ट्रेस हो गया है। तो टेस्टिंग लैब और इंफ्रास्ट्रक्चर पे स्ट्रेस जरूर हुआ है, लेकिन उसकी जो तीव्रता है, जैसे आपने सही बताया, वो बहुत कम है और अस्पतालों में अभी अगले 2-3 हफ्ते में हमको पता चलेगा, बहुत ज्यादा इसका इम्पैक्ट नहीं होगा।
While experts differ on when India will peak, most agree cases will decline by the end of February.
In cities like Delhi, Mumbai, where the numbers have been rising very fast for past week or so, they will continue to rise very sharply, with the peak estimated somewhere around middle of this month. That is, in about a week, 10 days from now.
India had such a terrible Delta wave. That combined with vaccination efforts suggests that there's quite a bit of immunity in India that will provide some protection against Omicron. So what we expect to happen is lots and lots of Omicron infections, reaching a peak in the end of January or first week of February.
Doctors say it is not the caseload we should be looking at this time, but hospitalizations and ICU admissions.
What is different
from the Delta wave so far has been that the number of people who require inpatient hospitalized care is substantially lower than it was for Delta.
Sources within the INSAGOG, the consortium of labs undertaking genomic sequencing in India, say that in metropolitan cities, the prevalence of Omicron is to 90 to 95%. They also say that Omicron is well on its way to replace Delta as the predominant variant in India. Well, the rate of infection is much more. But hospitalization and oxygen use is not alarming. Far from it is what sources indicate. In New Delhi, Sneha Mordani for India Today.
And while we talk about the situation here in India, the situation in the United States is perhaps even more alarming. It has broken all records in terms of the number of hospitalizations at this point of time. 132,600 hospitalizations in the United States at this time, smashing the earlier horrible record that was set in January last year. Take a look.
COVID-19 hospitalizations in the U.S. reached the highest level of any other point in the pandemic on Monday as a surge in infections caused by the highly contagious Omicron variant strains healthcare systems. According to a Reuters tally, 132,646 people were hospitalized with COVID, surpassing the record of 132,051 set in January of last year. But this time is different.
So now let's talk about the COVID numbers.
Dr. Rahul Sharma, emergency physician-in-chief at New York Presbyterian Weill Cornell Medical Center, says that unlike prior surges, only 50% of his hospital's COVID patients were admitted due to classic symptoms such as difficulty breathing, pneumonia, or low oxygen levels.
The remaining 50% of these COVID hospitalizations are patients admitted for other causes. For example, heart attacks, strokes, abdominal pain, cancer, other infections, but who happen to incidentally test positive for COVID, since everyone that's admitted to the hospital is tested for COVID. Now today, the fact that a large number of our COVID hospitalizations are incidental really reflects the level of community spread of Omicron.
He added that half of those hospitalized with COVID at New York Presbyterian are vaccinated. And while his hospital is already stretched to capacity, the worst may be yet to come.
We'll need to examine the numbers over the coming days, but we anticipate a peak in the next week or two.
Across the country, hospitalizations have increased steadily since late December, doubling in the last 3 weeks as Omicron quickly overtook Delta as the dominant version of the virus. Several states, as well as Washington, D.C., Puerto Rico, and the U.S. Virgin Islands, have reported record hospitalizations. But there is some good news, as Omicron appears to be potentially less severe than prior strains, as Dr. Sharma has seen in New York.
About 10% of these COVID hospitalizations right now are in the ICU, and 5% are on ventilators. Now, as a point of comparison, this is a lower number than during the 2 prior surges.
Deaths nationwide from COVID are averaging 1,700 per day, up from about 1,400 in recent days, but within levels seen earlier this winter.
Amidst this huge COVID surge once again and the third wave that we're all battling, other ailments obviously don't stop, especially dental ailments, tooth decay, cavities, getting braces added. How difficult or how safe is it for you to actually go and see your dentist? And are there any protocols that you should be following when you think of stepping out to go and see your dentist? Chetty brings you this story.
The mouth is known to harbor maximum infections. Hence, dental care plays a huge role in Omicron times. Whether you are positive or negative, you cannot avoid oral hygiene and care that can really help you with overall wellness. Let's begin with dental care in Omicron times. How should you care about your dental health?
When tested positive, use a 0.2% chlorhexidine mouthwash. Gargle with it for minimum 30 seconds. Wash and disinfect your toothbrushes with 1% hydrogen peroxide or plain soap and water. Keep your toothbrush and toothpaste in separate containers which are closed and ventilated. Keep it standing to ensure drying of the toothbrush head. Change your toothbrush once you go from COVID positive to COVID negative. Sip water every 2 hours to stay hydrated. And not to forget masking and hand sanitization to keep yourself free from any germ.
First and foremost, brush twice daily, floss every day, once a day at least to reach those surfaces where brush cannot reach, and use a good mouthwash like a povidone iodine or a chlorhexidine mouthwash. Eat a healthy, balanced diet, and try to limit the intake of sugary drinks and snacks, because the more frequently we are taking sugary drinks, our teeth are more prone to catching any decays. And avoid tobacco and smoking as much, and do not postpone your dental treatment or any current dental problem. Kindly attend to it in time.
Do not postpone dental procedures. They can lead to serious illnesses, according to dentists.
There is a stringent protocol in place for the safety of the patients and the dental professionals team at the dental clinic. These includes the prior teleconsultations, which help categorizing the patients into high risk and low risk categories, and also we can determine whether the patient would require a physical examination or an immediate dental treatment procedure. Also, there are certain protocols for the dental operatory, like the PPEs for the entire team, the high vacuum suctions, and the pre-procedural mouthwashes like povidone iodine that are been found effective against the various viruses.
Dentists also explain how you can feel safe at a dentist clinic and SOPs that are followed that reduce your chance of catching the virus. That includes pre-procedural mouth rinses and staff in PPE suits.
A dental clinic is an absolutely safe place to visit if you need to undergo any urgent or emergency care. Within the operatory, the patient is advised to do a pre-procedural mouth rinse to reduce the bacterial or viral load in the oral cavity. The operatory is equipped with HEPA filters, high-volume suctions to maintain a clean air. Instruments that are used are either disposable or autoclaved.
Finally, the high-risk dental cases are made to feel safe at all costs.
We cannot deny that the dentists, the auxiliaries, and the patients are at a high risk of cross-infection because of their close proximity during the dental procedures. But I would also say that it is safe to visit a dental clinic which has the COVID prevention protocol in place.
So if you are wondering if you need to visit a dentist, assess where you stand. If you feel one or more of these symptoms, you have to get them addressed. The symptoms include extreme tooth sensitivity causing constant pain, bleeding gums, extreme toothache, swollen gums or cheeks, trauma from an accident. Seems like COVID is here to stay, so go ahead, look after your oral hygiene. In New Delhi, Chaiti Narula for India Today.
And now the war of the Sardars in state of war, Punjab, has gone to the next level, and it's very, very personal this time. Rivals Bhagwant Mann of the Aam Aadmi Party and Navjot Singh Sidhu have combined forces to attack Captain Amarinder Singh and his new party's election symbol, which is a hockey stick and ball. Bhagwant Mann says Captain's fate will be the same as torn cloth balls. Sidhu says he challenges the captain to play hockey for even 15 minutes, basically commenting on his fitness. Sidhu says the captain can barely stand, he should retire. Personal attacks focused on Captain Amarinder Singh from Bhagwant Mann of the Aam Aadmi Party, as well as Navjot Singh Sidhu, the state Congress chief in Punjab. Kamaljeet Sandhu reporting live from Moga in Punjab as these political quakes begin to erupt. Sidhu and Bhagwant Okay, before we go to Kamal, let's just listen into what both these leaders have said.
ਕੈਪਟਨ ਸਾਹਿਬ ਨੂੰ ਹਾਕੀ ਤੇ ਬਾਲ ਇਹਨੂੰ ਵੈਸੇ ਪਿੰਡਾਂ 'ਚ ਖਿੱਦੋ ਖੁੰਡੀ ਕਹਿੰਦੇ ਨੇ ਤੇ ਖਿੱਦੋ ਉਹਨਾਂ ਕੋਲੇ ਹੈ ਨਹੀਂ ਹਜੇ ਪਰ ਜਦੋਂ ਖਿੱਦੋ ਬਣ ਗਈ ਉਹਨੇ ਲੀਰਾਂ ਖਿੱਦੋ ਜਿਹੜੀ ਖਿੰਡਦੀ ਆ ਉਹ 'ਚੋਂ ਲੀਰਾਂ ਨਿਕਲਦੀਆਂ ਬਸ ਸਿਰਫ ਸੋ ਮੈਨੂੰ ਨਹੀਂ ਲੱਗਦਾ ਕਿ ਪੰਜਾਬ ਦੇ ਲੋਕ ਜਿਹੜੇ ਨੇ ਉਹ ਦੂਜੀ ਵਾਰ ਵੱਡਾ ਕੋਈ ਧੋਖਾ ਖਾਣਗੇ ਜਿਹੜਾ ਪਹਿਲੀ ਵਾਰ ਕੈਪਟਨ ਸਾਹਿਬ ਤੇ ਯਕੀਨ ਕਰਕੇ ਖਾਣਗੇ
Sandhu, my colleague, live with me from Moga in Punjab. She's been reporting the entire gamut of political eruptions in Punjab. This one is a personal one. Kamal, very interesting. A day after the hockey stick and ball symbol was unveiled by Captain Amarinder Singh, twin attacks on the symbol of a very personal nature coming in from Bhagwant Mann on one side and Sidhu on the other.
Well, in less than 24 hours from the time the symbol was announced by the Punjab Lok Congress or the Captain Amarinder Singh's party, there have been snide remarks coming in. Pargat Singh, one of the former captain of hockey team, he hit out saying for a novice like that, this will only be a self-goal. After that, we saw Bhagwant Mann and Navjot Singh Sidhu jump into the entire controversy. One of them saying this is like a tattered cloth ball and nothing much is going to come of it. Navjot Singh Sidhu, on the other hand, has hit out at Captain Amarinder Singh saying he is a round man. He can barely stand even for 15 minutes. What game is he talking about? It's time for him to retire. So these are the sort of remarks which have been made, especially on a politically hot day when Bikramjit Singh Majithia has made an appearance for the very first time in public. That's the time they have chosen instead to hit out at the captain. And remember, making snide remarks. So perhaps also giving an indication that captain is very much in the game.
The war of the Sardars going to the next level, taking on an all-new avatar. Now it was originally Captain Amarinder Singh versus Sidhu. Now you've got Bhagwant Mann also jumping into the mix. It's going to be a very, very hot political battlefield in the state of war, Punjab. Kamal, thank you very much for getting us that story from Ground Zero. Now, from that Punjab potboiler to political Pradesh, the other big state that is in election mode, Uttar Pradesh, where there is its own political eruption that has just taken place. Back-to-back resignations are stunning the ruling BJP ahead of elections in Uttar Pradesh. UP Labour Minister Swami Prasad Maurya has quit as minister and switched to the rival Samajwadi Party of Akhilesh Yadav. Swami Prasad Maurya, in his resignation letter, wrote, and I quote, "Despite a divergent ideology, I worked with dedication in the Yogi Adityanath cabinet, but because of the grave oppression of Dalits, OBCs, farmers, unemployed and small businessmen, I am resigning." But that's not all. It's not just Swami Prasad Maurya. Roshan Lal Verma and Bhagwati Prasad, both BJP MLAs, have also quit the party. Caught on a wrong foot, the BJP, which usually is exuding a lot of election confidence, has roped in Sunil Bansal and Swatantra Dev Singh to do some damage control and attempt to pacify the dissidents. We've even seen Keshav Prasad Maurya tweet to try and get people like Swami Prasad Maurya to change their minds.
ये आपके ऊपर आरोप है कि बेटे को टिकट नहीं मिला इसलिए आप पार्टी छोड़ दी। अरे बेटे या बेटी को टिकट मिला ना मिला इससे कोई मतलब नहीं भाई। हमारे सामने पूरा प्रदेश है, दलित है, पिछड़ा है, किसान है, बेरोजगार नौजवान है, छोटे लघु मध्यम व्यापारी हैं, इसलिए उनके हितों की मुझे चिंता है। एक बेटा नहीं 1000 बेटे हमारे उत्तर प्रदेश में हैं, इसलिए हम उन सब की लड़ाई लड़ते हैं। हम केवल एक बेटी और बेटे के चक्कर में राजनीति नहीं करते। आप विधायक लेकर इस्तीफा लेकर के गए थे स्वामी प्रसाद जी का, आपका अपना क्या निर्णय है? इधर
स्वामी प्रसाद जी के साथ
आप भी इस्तीफा दे दिए विधायकी से?
ऐसा है, आचार संहिता लग गई, विधायकी कोई उचित नहीं होता है। मैं कोई
बीजेपी छोड़ रहे हैं ना? बीजेपी छोड़ दी आपने?
छोड़ नहीं रहे, छोड़ दी है। स्वामी प्रसाद जी के साथ
सपा में जा रहे हैं?
बिल्कुल बिल्कुल।
अच्छा ये बताइए 5 साल तक, ये बताइए 5 साल तक,
अरे 5 साल तक शिकायतें आप लोगों को जानकारी होगी। करते रहे, अपने उच्च नेताओं से करते रहे कि ये नहीं सुन रहे हैं।
कौन नहीं सुनता है? किस किस से शिकायत करी? कौन नहीं सुन रहा था? मुख्यमंत्री से?
मुख्यमंत्री जी से शिकायत की, संगठन शिकायत की, स्वतंत्र देव जी से शिकायत की, एक बार नहीं की, अनेक बार की है।
क्या शिकायत होती थी आपकी?
जी,
क्या शिकायत होती?
जनता की जो समस्याएं थी उनका निवारण नहीं हो रहा था, जनहितकार नहीं हो रहे थे, उपेक्षा हो रही थी।
तो नहीं तो उसके बाद शिकायत के बाद किसी ने सुनवाई नहीं करी? नहीं तो किस आप ये बताइए कि आपके साथ और भी लोग हैं जो समाजवादी पार्टी में शामिल होने जा रहे हैं?
मैंने कहा कि वक्त का इंतजार करिए, थोड़ा सा वक्त सब पता लग जाएगा।
देखिए, हमने अपना इस्तीफा माननीय स्वामी प्रसाद मौर्य जी के समर्थन में दिया है और जो भी निर्णय माननीय स्वामी प्रसाद मौर्य जी का होगा हम उस निर्णय के साथ में हैं और जहां पर भी वो जाएंगे वहां पर उनके साथ रहेंगे। लगातार भारतीय जनता पार्टी में रह करके जनहित के कार्यों को कराने का प्रयास रहा है, लेकिन जिस तरीके से भारतीय जनता पार्टी की सरकार ने गरीबों और कमजोरों की उपेक्षा किया, खासतौर से पिछड़े दलित अल्पसंख्यक वर्ग के लोगों की, तो जिस प्लेटफॉर्म पर बात रखनी थी वो रखी गई। जब सुधार होता हुआ नहीं दिखा है तो आज ये निर्णय हम लोगों को लेना पड़ा है।
India Today's Polami Saha is with me live. Polami, everyone watching these sudden developments in Uttar Pradesh, on the face of it, all of these leaders have made, some principled indignation over certain issues like, OBCs and Dalits, the reasons for their exit. But what's the reality? We all know that it's never usually about such things. There are always wheels within wheels. What's going on? Is this about tickets? Is this about family members? What's the real story, Polami?
Well, Shiv, it definitely boils down to ticket distribution. Now, we believe that Mr. Swami Prasad Maurya wanted a ticket again for his son Utkrisht in these elections. Utkrisht had fought the assembly elections in 2017 but lost. Swami Prasad Maurya, at that time, just a few months ahead in the year 2016, towards the end of 2016, had joined the Bharatiya Janata Party. He had jumped from the BSP to the BJP after spending 2 decades in the BSP and joined the BJP just ahead of the 2017 UP elections. He and his son were given a ticket. He won, son lost, and then eventually, but because he was able to consolidate a lot of the non-Yadav OBC vote for the Bharatiya Janata Party, despite his son's loss in the assembly election, his daughter was given a ticket. Sanghamitra Maurya was given a ticket in the Lok Sabha elections of 2019 from Badaयूं. She won from Badaयूं. She defeated Dharmendra Yadav from that seat, from the Yadav family, and then of course he was made a cabinet minister as well. He was made a cabinet minister earlier in 2017. So the BJP believes that the family was adequately rewarded for the kind of votes that Swami Prasad Maurya brought with him, and obviously his experience. He's not a small fry. He definitely is a very senior leader. He's been a minister in both Mayawati governments. He was leader of opposition twice when with the BSP. So he has some amount of influence, but the BJP believes that he is someone who's an opportunist, who's just jumping from ship to ship in order to extract the best for his family members. It's beyond him. It's not about Swami Prasad Maurya. It's about his family now.
So whatever be the reasons, the one thing that we can say for sure is that the BJP is trying to troubleshoot. The BJP finds itself in unfamiliar territory. It's not always used to seeing people leave from its side and go to the other, and that too on the threshold of this crucial election in Uttar Pradesh. So all stops are going to be pulled out to try and troubleshoot the situation. As Polami confirms, it's all about ticket distribution for family members. Now, things could actually get worse for the BJP in Uttar Pradesh if the words of Sharad Pawar are to be believed. And that's the breaking story we're bringing to you. Sharad Pawar says it's not 1, it's not 2, it's not 3, but 13 MLAs who are going to be joining the Samajwadi Party very soon in Uttar Pradesh. Sharad Pawar says 13 MLAs are going to be quitting from the BJP and joining the Samajwadi Party. This comes on the back of the Swami Prasad Maurya resignation, as well as Roshan Lal Verma and Bhagwati Prasad, both BJP MLAs who have quit. So he says it's not 3 MLAs, it's 13 MLAs who are going to be joining the Samajwadi Party. We don't know if that's true, but Sharad Pawar says that's what he thinks is the truth. Now, India Today's big news break last week on all the parties being forced to go digital for the campaign of 2022 was confirmed by the Election Commission. No surprises there. India Today always breaks the big election stories. But now on the ground, India Today's Ashutosh Mishra, on the back of this big news break, tells you about this new virtual avatar for parties in Uttar Pradesh. He actually goes down to look at what those digital blueprints look like and which party perhaps has the advantage.
No road shows, no rallies. Election campaign for the 5 state assemblies has now got a new avatar. And with campaigning taking the digital route, it's raining opportunities for specialists in the field. This is boom time for digital campaign designers as parties and their candidates are roping in the best in the business to push through their political messages. From small town to the metros, digital media campaign companies are working round the clock, drawing up strategies. This includes using social media platforms like Twitter, Facebook and Instagram, besides audio messages and phone videos. The absence of Padayatras and a limit to door-to-door campaign means more LED vans that can swiftly move from village to village and town to town.
When mega gathering by the Election Commission has been banned in 5 states, how the campaign will be lifted? Well, now the onus is on the digital companies. As we heard, the digital campaignings will be promoted, not only the political parties, the smaller regional political parties, national political parties, but even the candidates have now roped in several companies, national companies, international companies. And look at the setup. Now, on this virtual, someone can even project me as James Bond. Well, these mega high-tech companies with their advanced skills, advanced technology, using best to support their candidate, their parties, and all it influences the voters' mind, including the social media platforms, digital media platforms. In absence of the physical meetings, physical gatherings by the politicians and the political leader, the mega challenge is to reach out to the voter, door to door, house to house, village to village, small town, mega towns. Now, the digital companies are seeing really surge in the demand from the political parties and the candidates, and they're working round the clock to lift the campaign to make it more influential.
A digital media company based out of Noida explains why political parties and even some individual candidates have engaged it.
सबको इक्वल प्लेग्राउंड है यहाँ पे. इस पे कोई मैटर नहीं करता कि आपके पास बैकग्राउंड में आपका फिजिकल इंफ्रास्ट्रक्चर कितना स्ट्रांग है या नहीं है. इवन एक इंडिपेंडेंट कैंडिडेट, अभी हम किसी के लिए काम कर रहे हैं जिनके लिए वो इंडिपेंडेंट भी है, और उनको भी इक्वल अपॉर्चुनिटी है. सारा गेम है आपका टीम कितना स्ट्रांग है, और उसके अलावा
पैसा कितना है.
पैसा बिल्कुल मैटर करता है, क्योंकि आपका जो कंटेंट डेवलपमेंट है वो भी आपका देयर इज अ कॉस्ट टू इट. और इसके साथ साथ अब आप जब एडवर्टीजमेंट्स रन करते हो तो ओटीटी के थ्रू आप एडवर्टीजमेंट्स को रन कर रहे हो, तो वहां पे एडवर्टीजमेंट्स में पैसे का ही गेम है सारा.
Some politicians believe that digital campaign is unfair to those without means, that it does not provide a level playing field.
मान लीजिए एक्स पार्टी का नेता वाई पार्टी के नेता पर दुष्प्रचार या उस तरह का कोई प्रोपेगेंडा करवाना हो, तो उस तरह की वीडियोस की भी मांग है क्या मार्केट में?
सबसे ज्यादा उन्हीं की डिमांड है, लेकिन हम नहीं करते हैं. जो करने वाली कंपनियां हैं, हो सकता है, ऐसा नहीं कि नहीं करती हैं, करते हैं, लेकिन वो पार्टी हैंड से ही होता है. पार्टी हर पार्टी का अपना अपना आईटी सेल होता है. आईटी सेल वालों को संरक्षण मिला होता है, राजनीतिक संरक्षण, और सबसे ज्यादा राजनीतिक संरक्षण तो आपको पता ही है कि जो सत्ता में पार्टी होती है उसी को संरक्षण प्राप्त होता है आईटी सेल वालों को.
A very modest digital campaign could cost anywhere between 4 lakh and 15 lakhs a month. Expand it further to include the entire state and you are talking anything from 10 to 15 crore rupees a month. The scale of campaigning is directly proportional to how deep your pockets are. Besides the big digital companies, there are independent and freelance experts who work anonymously and independently for a party but are largely hired by candidates. They specialize particularly in targeting the rival candidate.
स्वाभाविक है, बिना पैसे के तो कोई खेल हो ही नहीं सकता है. पहले की अपेक्षा अब ज्यादा पैसे का,
जो जिसके पास ज्यादा पैसा वो ज्यादा प्रभाव डालेगा,
बल्कि जिसके पास पैसा होगा वही प्रभाव डालेगा. जिसके पास थोड़ा पैसा है वो चुनाव ना लड़े तो बेहतर है.
The cyber warriors also admit that digital campaign is all about how much money one has. The bigger your spending power, the bigger your virtual campaign. Hard cash is needed to obtain data and information on voters. For example, their mobile numbers and other contact details.
It's all about game of data. The digital marketing companies, digital campaign companies mainly relies on data, and the data is only the information about you, me, and everyone around. It is easily available in the market. From 3,000 rupees to 5,000 rupees, you get data of 1 lakh people, which is easily floating all over. And then these companies take our data, they just buy it from the open market, and then next day onwards, we start receiving WhatsApp messages, political materials, campaign materials, banner, posters, some campaigns which should not also be the part of campaign, but unfortunately this is also happening in these days, election campaigning. But what comes significant is the data which is easily available in the market, and that is a gold mine for these digital companies.
India Today spoke to some data selling companies, and they confirmed that they sell contact information for 3,000 to 6,000 rupees. From insurance selling companies to election management gurus, they service all. Once they have the access to the data, the voter's phone and WhatsApp is compromised.
मुझे बेसिकली वोटर्स के तौर पर चाहिए ताकि हम उनको मैसेज भेज सकें पॉलिटिकल कैंपेन के लिए.
वोटर्स के तौर पे चाहिए.
18 के ऊपर वाले.
मिल जाए. कौन सी लोकेशन में चाहिए सर?
नोएडा दे दीजिए, लखनऊ दे दीजिए.
मिल जाएगा सर आपको.
कितना कॉस्ट पड़ेगा मुझे?
सर 1 लाख डेटा 3,000 रुपए का है.
सॉरी?
1 लाख डेटा जो है 3,000 रुपए का है.
अच्छा. और जैसे मैं कई सारे कैंडिडेट्स के लिए काम कर रहा हूं, तो मुझे आप बता सकते किस किस इलाकों का आप दे सकते हैं डेटा?
सर मेरे पास ऑल ओवर इंडिया का अवेलेबल है डेटा में, आप कहीं का भी ले लो.
COVID-19 has forced a new paradigm of election campaigning on political parties. Data on people has become king, but it means spending money. One thing is clear, the more the money, the better your chances of influencing voters. With Ashutosh Mishra, Bureau Report, India Today.